Hello everyone. You're listening to Nick.
And I'm Helena, and we both work here at the MS Trust, a charity for people affected by MS in the UK. We are here to help you make sense of MS.
Yeah, thank you so much for listening to us today, for joining us on our podcast. So, our podcast is Multiple Sclerosis Breaking It Down. And today we're actually going to be jumping back in to a recording from last week that we had on our MS Trust social media. So, that was live on YouTube, Twitch, Facebook, and Twitter. And we were catching up with Claire Winchester, who's our head of information and engagement. And Helena chatted to her about a big report that we did, a huge survey that was called Life Changing Mental Health and MS. And that's one that we put out earlier in the year.
And we thought, as so many people, like probably your listeners, but lots of people that we've been in touch with over the year, actually took part in the survey. We really wanted to do a podcast about what you really had to say about life with MS in the UK in 2023.
Yeah, and we thought actually a good way to do that was to do it as a live stream, as a live recording. So we knew that, some people would be able to join us or watch it back later or even listen to it now as a podcast. So we do a few live streams across the year. So you might be able to catch up on the next one. So do give us a follow on whatever your platform of choice, so that you can see us on there and interact with us a little bit. And it's a good way to build the community and reach out to people and engage with people that we support who live with MS. So yeah, amazing stuff. And I think that's probably enough from myself and Helena. So let's jump straight back in to the line where you'll hear Claire and Helena.
Hi everyone, hope you have all tuned in now. Thank you so much for joining us for this live stream of the MS Trust podcast. And today we're going to talk a little bit about a report that we put out earlier this year. I am Helena, and if you tuned into us in the past, you might think, well, that's not Nick, that's someone else. Nick is also here. He is in the background, and he will be chatting to you today. If you have any questions or anything, you can put a question in. If you're on Facebook or YouTube or Twitch or Twitter. But I am here, and my name is Helena. And myself and Nick, we both work in the communication team here at the MS Trust, a charity to help people make sense of MS in the UK. And for anyone who isn't familiar with the work of the MS Trust, we're here for everyone affected by MS from the moment of diagnosis and onwards. And we work to make sure that people living with MS can access good quality specialist care and live the best life possible. And we do this in a few different ways. We place and train MS health professionals across the UK, including specialist nurses and advanced MS champions. We also produce practical evidence-based information, both online and in print. And this podcast and videos are one of those things. Plus, we have a very friendly and knowledgeable inquiry service team that are available for anyone who wants to know more about MS. But we'll talk a little bit more about those guys at the end of this session. But we're basically here to help everyone make sense of MS. And today we are going to be chatting to our head of information here at the MS Trust. This is Claire Winchester. Claire's been on the podcast many times if you've tuned in before, but for those who haven't seen or heard you before, would you like to tell us a little bit what it is you do here at the MS Trust?
Sure, yeah. So I'm Claire. It's lovely to be here today. My role is Head of Information and Engagement at the MS Trust, and I look after the team that deliver the inquiry service and create, manage and organise the information that we produce, the evidence-based information across the website, in our publications and in podcasts and films, as you mentioned, and so many other places. So I'm delighted to be here.
And I just wanted to say thank you to everyone who's tuning in. I think I can see some comments popping through. Nick will filter them through. If you have any questions during the podcast, we're mostly going to be talking about this report that we put through. So Claire will be happy to answer
Yeah,
any questions
absolutely.
regarding that. If you have any other questions, Nick will try to respond to them. Otherwise, just, you can always contact us at a later point or call the inquiry line, but we'll give all that information later on.
Absolutely.
Now, we've been sort of talking about this report. Claire, do you want to tell me us about it? We kind of refer to it as the listening project.
Yeah, so the listening project is something that the MS Trust has been focusing on for a couple of years, and it's an ongoing project to make sure that we really get the voices of people with MS and into all the work that we do, and that we get insight into your needs, into the services that you're involved with, and the information that you really want to have. So it helps us to direct our energy in the right way, to make sure that we're really meeting the needs of people with MS. So the listening project is the overall project, and each year we focus on something a little bit different. So the first year that we ran it in 2022, we did something quite general. We wanted to find out essentially what you want to tell us. So rather than thinking, let's do a survey on this and just sending it out, we started with a really extensive co-production process where we got a lot of people with diverse backgrounds and interests and experiences with MS together to say, what haven't you been able to talk about? What haven't you been able to share? What would you like to tell us? And so that co-production process was really useful, and that then set the scene for the first report that came out, which we called Life Changing, hopes and fears. And it was a lot about that, was talking about the future and uncertainty and difficulties with daily life that sometimes go unseen. The 2023 report is called Life Changing MS and Mental Health. The first report really gave us an inkling that there was a big underexplored problem with mental health and MS. A lot of people we're very aware from other work that we do that a lot of people aren't sure or about how that relationship works. Is mental health something that is an MS symptom? Is it something that arises due to problems and challenges with living with MS or anxiety around diagnosis? And there's more work going on in sort of research and medical side of things, where people are looking at the difference between sort of distress. It's not nice to get a diagnosis of MS, but there's a difference between getting over a diagnosis and what you need to do to support somebody at that point, compared to supporting someone who's been living with complex symptoms for many years. So it's how the mental health needs change through time. So in that backdrop, what was really important was that we got this survey out to as many people as possible, and we are delighted to it was amazing. Were you in the office that day?
Yeah.
We sent the survey out via email, first of all, to everybody that has consented to having emails from the MS Trust, and then we set it out on social media to all sorts of different channels, and we got something like 400 responses in the first half hour. It was crazy, and that alone, you see, that tells me that people want to talk about this. People really, really want to tell us about that impact. So in the end, we collected over 2,000 responses. So, and it wasn't a simple little survey. It took, it would have taken you kind of 8 or 10 minutes to kind of work through it and answer it and respond. So I'm hugely grateful for all the people who put in that time to do that, because it's a really useful data set, and it tells us so much about the mental health needs of people with MS, and also about how MS impacts mental health. Which I think is what we're going to unpick a little bit more.
So we just wanted to say thank you so much to anyone who's listening now, or listening to this as a podcast later on, who actually took part in it. It's brilliant. If you have taken part and you are in the chat rooms, you can always let us know what you thought of the survey. But like Claire said, it wasn't a short survey. It was a massive survey. There was a lot of questions.
No survey is ever perfect, and we want to balance between making it really accessible and allowing people to say what they want to say, without being getting too bogged down in some of the demographics. But at the same time, we want to know who we're speaking to. So if you've kind of waded through a couple of minutes worth of where you live and your educational status and stuff like that, and you think, well, how does that matter? How does that connect to MS? But really, it's about making sure that we have really got a really accurate and representative picture of the UK in mental health.
Well, that's the thing, isn't it? Because often we say that maybe England is more overrepresented in information and things. So we were really wanting to make sure that everywhere
I was very gratified. The response rate from the different UK nations was about equivalent to the different population levels in the different nations. So yeah, I mean, there's a vast majority of responses from England, just because it is the most populous of the 4 nations. But I'm very happy to start sort of talking a little bit about some of what we found there, if you like.
Yeah, because I mean, obviously, with so many people responding, there was lots of things to talk about. So do you want to give me some highlights?
So I think the highlights for me, I mean, we could have a couple of slides at this point if you fancied, Nick. The first slide I want to show you was just our takeaway headlines, basically. It's not rocket science, I guess, but I think these are really important things to say. Mental health concerns are widespread among people with MS. They can be distressing and debilitating. I think the thing that was most interesting for us, that I think was genuinely new, was how the extent to which MS symptoms are major contributing factors to poor mental health. So it's not the diagnosis or stigma or other things. The thing that got on your nerves most, that impacted your mental health most, was living with symptoms. And of those symptoms, it was walking difficulties, fatigue, bladder and bowel issues, and then to a further extent pain, are the things that are really tricky to live with. And it certainly, as a call to action, it tells us that if we can start fixing and helping and supporting and managing those symptoms better, then it's not just an improvement in symptomatic health. It's going to be an improvement in mental health and quality of life much more generally. So I think that's a real call to action. And I think that third point, too many people with MS are struggling with poor mental health alone or with inadequate support. We know how difficult it is for anyone in the UK to get hold of mental health support right now. We think there's a really unfortunate, falling between two stools with mental health and MS. The mental health services are unsure how to cope with somebody who has a neurological condition. The neurological services aren't geared up to support the mind. They're about, they're interested in the wiring, not the program. So it's really tricky. But also people aren't talking about it and are not disclosing their struggles to people, which makes it really hard to get a sense of the prevalence of mental health problems.
And it's interesting, isn't it? Because I think during lockdown and everything, we have gotten better at talking about mental health, but there's still, I mean, especially maybe the younger generations they often talk about Gen Z being good at talking about mental health, but we've still, people that are older, that grown up with this kind of just must carry on, stiff upper lip and
absolutely things. Let's flick through the slides a little bit and see. So this is very quick. 2,068 people with MS responded. So we took, if you answered the survey but you didn't say that you lived in the UK, you were taken out for this analysis, although we really value your thoughts as well, and I think that contributes to the wider insight piece. And these are the people that responded, and I think this is quite interesting. We often do more than half of the people who responded had relapsing remitting MS. Primary progressive MS is that dark blue. Secondary progressive is that pale blue, and the very pale blue is other. So there's other kinds of MS, tumour facing, all sorts, or unknown. But I think the fact that we've got nearly half of our respondents are living with progressive MS, and so I think we have to keep in mind that there are very different challenges to people with different diagnoses and at different stages.
I'm just going to say, for anybody who's just listening to this, we have a link in the show notes to the report, so you can look at the actual stats yourself.
These are just pictures drawn out of the report. It's all there in public. So this is what, in general, 94% of the people who responded said that MS had altered their life, and for 50% of them, they said it completely changed. It wasn't just a bit of a change; it was completely changed. And it's not really surprising that has a knock-on effect on mental health.
Big numbers.
So these are the things that MS affects, and work and career, hobbies and pastimes, self-esteem. Ignore the bar at the bottom. They should total 100, but that's a mistake. But I think the very significant impact on so many different things. Self-esteem ability to live independently, sexual relationships, daily activities, hobbies and pastimes. And that's really significant. And that's, I think, one of the things that a lot of people pulled out in the comments.
Yeah.
What is life if you can't do the things that interest you? If you've had to stop sailing or walking, or you can't hold a paintbrush anymore, or your vision's troubling you and you can't read. I mean, there's so many things that make life really worth living and make life really interesting.
Yeah.
And for people that are finding that MS is getting in the way of their hobbies and pastimes, that had a really significant effect. And I think the working career then also comes out very strong.
Yeah.
Because there's something about, not connected, of course, to self-esteem, I think.
Yeah, definitely.
And finance. If you've had to retire earlier than you thought you were going to have to, if you've built a career that you're really proud of and had success, and to find that has been taken away from you by MS, really difficult for people.
There's a proper domino effect with these things, isn't it?
Yeah, absolutely. On the next slide, so when we asked specifically about mental health, 56% of people who responded said that MS had impacted their mental health moderately or severely. We drilled into some of these different things and found that actually many more people than 56, much more than 56% overall were experiencing mental or emotional health symptoms, things like anxiety, depression, mood swings. And we were really, really shocked and troubled to see that 17% of respondents had been troubled by thoughts of suicide. Now that is much, much higher. And I mentioned that to a senior MS nurse in London, and she said, when I read that, I was, I knew I had one or two people on my caseload who was really struggling, and I'd mentioned that, but 17%, that's a huge amount, nearly 1 in 5. Now it doesn't mean that people are feeling suicidal all the time, but it means that thoughts like that, thoughts of ending their life early had troubled them, had come across them. And that's really, really worrying. So,
And it's certainly something that we see pop up in our MS Trust Facebook group now and again. There are people sort of saying about those kind of dark thoughts and thinking of the future and what lays ahead.
Absolutely. So that this graph just shows those things I just mentioned. We can flick on, I think. So this one I put in order, what aspects of MS or what aspects of life with MS affect your mental health most? And changes to walking ability or mobility, getting out and about is a massive problem for more than 70% of people with MS, or it's enough of a problem to be a real pain in the neck and a real drag on the mental health, which is such a shame. I mean, part of that is going to be tied up with fatigue, part of it's going to be tied up with bladder and bowel and thinking and memory. But it's the fact that the symptoms came up higher. The top 4 answers there are symptoms. And then the further ones, working life and career, hobbies and pastimes, families and dating, sex. These are much lower down, although they're still very significant. So I think that's really that's a call to action for us. I think so. This is where we need to be focusing. And so many of the responses, your answers were really poignant, and there are some very personal statements. There's a couple produced anonymously. I've not been able to tell my family. I feel under-supported by healthcare and even critiqued. Feel like I'm living a lie and I'm exhausted after 13 years of fighting for help.
That's frustrating.
Yeah, absolutely. Just makes me really so frustrated. I can't do the things I used to. I really try to think positively about things, but then again, I think, what is my purpose in life now? It's just a horrible illness. So there's, we've got that additional, really personal insight. Bring a report that's all numbers. It helps you bring it to life, I think, and really paints a picture for people who might not have a family member with MS or know somebody with MS. So when we're trying to get that message up and out, then we need these personal comments. They're so valuable. So thank you to anyone who shared that. So this brings me on to the next issue. Have you told anyone about the impact that MS has on your mental health? So there's some people, just under 10% of people have, they said they've been very open about their mental health issues. They've talked about it lots of people. The majority, 50% of people who answer these questions said, I've told a selected few. I've maybe talked to my nurse, or I've maybe talked to my partner. A few people haven't yet told anyone but plan to do so.
Yeah.
But there's 30% of respondents who haven't told anyone about their mental health problems and do not intend to do so.
Yeah.
So why? This is the question. Why don't people want to talk about their mental health problems? Why don't people want to talk about the fact that MS is affecting their mental health? And I think that's such a shame.
Yeah.
Because I think that's going to contribute to the sense I mentioned that MS nurses are perhaps not aware of the scale, the problem that they're facing.
Did we get any comments from these people saying why they don't want to talk about it?
No, and that's an oversight of the survey. I would love to drill into that a little bit more. I think, the previous comment, that feeling of being critiqued, the kind of, oh, why can't you just pull yourself together, or you're just tired, get on with it. That's a real shame. Or they're trying essentially sort of hiding it. I'm not going to give in as a sense of denial. I'm not going to let MS win. Maybe there's that. But it is, I think, health issues, whether they're brain, body, or mind. Getting some professional help is always good, and it's the start the process of healing.
But it would be interesting to hear from you if you are a person who don't want to talk about it and don't want to talk to your health professional about it, just to let us know the main reasons for it, because it would be very interesting for us to learn that.
Absolutely. The next slide tells us about what professional support that is out there. So obviously there's, I've told, if you haven't told anybody, you can't be offered any help. Bottom line. 30% of people who have, you said they had received professional mental health support, which is fine. 10% said they'd been offered it, but they haven't yet received it. Well, there's delays, I guess. And then otherwise, 50% of people have told health professionals about their mental health, but they haven't been able to offer support. I think in the medical profession, there's a real big thing where there's a tendency to ask about things that you can do something about. If you become a doctor or a nurse, you want to help people. That is your career. So you're maybe much more likely to ask about bladder or bowel, because those are things that are easily fixed and referred to, rather than mental health, physiotherapy, or something where the waiting lists are years long. But that's not a good reason to not look for the help, and not to be looking to those services. So I hope this kind of data really helps the MS services to understand what they should be offering. I guess.
And this is something that obviously we feed back to our education team and the people who run the conference for the MS nurses as well.
Absolutely.
Because they're going to be more of a focus on mental health for them as well.
We will be presenting this at the annual conference in March, and we will be making sure that mental health is on the agenda for training. So here's a couple more, just sort of finishing up, what the future means, what MS means to your future. And I think these are quite poignant. I don't make long-term plans. I know I won't be able to start my hairdressing career again. I don't have the income to travel and do what I want to do. I mean, the impact of MS and mental health on life are profound. So,
Did I see that there was a question there, Nick? What we got?
Frustration really sums it up. Frustration with healthcare and not being able to get things done. Absolutely, Adrian. No, you're absolutely not alone. That's something that's been expressed quite a lot. Did you want to just go to the last panel? So I guess these are some other sources of information and support, including the contact details for our helpline if anything's come up.
And we will be sharing all these in the.
So that's it for the slides. But Adrian's comment on frustration is it. I mean, to have abilities and functionality just sort of taken away suddenly, or drip. I mean, it's and all the ways that impacts on people. So tricky.
And I think it's interesting because the report came sort of out for us to read just before MS Awareness Week. And MS Awareness Week, we had a big focus on mental health, didn't we? So I mean, we took away, especially with the sort of top symptoms that we were saying that affects health and mental health, and try to do a bit of focus around these.
Absolutely. So that takeaway that living with their MS symptoms, living with incompletely managed symptoms, basically, was a big impact. You had a big impact on mental health. So that gave us a steer. So for MS Awareness Week, we looked at those symptoms. We looked at the little things you can do to improve your walking ability, to improve pain management, to improve bladder and bowel symptoms, and increase people's confidence to be able to leave the house.
Yeah.
So profound things that really affect how people feel about their life.
Yeah.
So yeah, I think. I mean, I'm really proud that we were able to do that. When that report has been read a lot. It's been on our website for since MS Awareness Week. But we haven't just left it there. You know, we have joined together with a number of other charities to work on bigger mental health projects where we've made some recommendations for we recommend that there should be an MS mental health pathway.
Yeah.
This should be something that services which are being commissioned for people with MS should be taking into account. We really appreciate the need for better training for people, for MS specialists in mental health.
Yeah.
And they don't have to go all the way for a full on psychiatric counselling, but there are definitely things people can do as part of their nursing or therapeutic or every interaction, making every interaction with a patient count, and being able to offer that support and ask and be really holistic and person-centered. I think there's so much that can be done to just raise the game, and that's very much what the health professionals team here at the MS Trust are working on.
And I think that's really important, because obviously some people feel confident to tell their health professional, I'm struggling with this, but other times it really almost helps if the MS nurse has a set of questions and treats mental health on the same level as they would with the other symptoms.
Absolutely. I mean, I said, stigma might not be an issue, but I think mental health problems do come with a stigma attached in our society. Nobody wants to admit that they're struggling. People worried that they're not going to be taken seriously, or they're worried that they're going to be brushed off, or I think it's a real shame. But anyway, what else are we doing? What else have we done? We've done some lovely podcasts lately.
So we did quite a few things around MS Awareness Week and after. So we've had a podcast about getting to grips of using mobility aid, featuring our lovely ambassador, Hayley, who's talking about a lot about her struggles with mental health, sort of being more or less stuck indoors because she felt that she didn't dare to go out using her stick or her wheelchair, but then sort of getting her head around that kind of concept that actually going out is going to benefit my mental health. And I think it's really sort of showing that it is a process and you have to work your way through it.
Absolutely. And I really like that notion, that the symptom or the mobility problems are the barrier, but you get over that barrier and you get that knock-on benefit from not just from overcoming the barrier, but also from just doing what you want to do. Getting out there. That's so good.
But we will link to some of these that we put up, because there were some really good blogs around fatigue and bladder and bowel as well. I think just getting out and talking about it and sort of, it's again not easy issues. And some people sit quietly and don't open up about it. I recently went up to this information thing up at Addenbrooke's, where we were talking about things that people worry about in the future. And the neurologist there, he was looking at one of the slides and it said, I get so upset when I see people are worrying about bladder issues because there's so much help to get there. But people don't speak up about it. And he sort of said that this is really sad to see.
Absolutely. Those are things that are treatable. But if the barrier is in you, if you don't want to talk about it, you don't want to raise it. I mean, we took this kind of multi-charity report that I mentioned and our own life-changing report. We've taken those up to, up and out to sort of policy, to Downing Street, to the Minister for Disabled People, to really talk about that impact and demand change. Whether that's, it was very well received, I think. I've also worked with a number of other charities and organisations on raising awareness of particularly catheter use for bladder and bowel, particularly bladder, in the House of Lords, and that was really good to get, again, policymakers aware of the problems, but also aware of the solutions as well. So yeah, I think it's been a really active time, you know, but because we had this great data source, we were able to make a really good case.
Yeah.
And that's why we're definitely going to be doing that listening project again and again.
Yeah.
It's going to, you know, each year, I mean, I think it makes perfect sense to run it annually, to focus on something a little bit different, to be able to respond to changes in services, trends. And we noticed, for example, that mobility and transport problems are massive problems for people. So I think next year we'll be drilling down into that. We'll be doing some more research to find out what's getting in the way of getting out and about with MS. The impacts, you know, the knock-on effects from things like PIP and mobility, based benefits, getting support, you know, wheelchairs and walking aids. Just the design and location of services in life. You know, can you get into town? Can you get into the library? Can you get into the hospital? You know, some of the comments from this report were, you know, absolutely really gave us that insight. You know, saying, "Oh, well, my house is fine. My house is all adapted, and I can move around in my chair. My sister's isn't. I haven't been to see my sister in 3 years. Because I can't get into a house. Because you know, and it's little things like that. Life is so it's difficult for people with mobility problems. So so look out for the next listening project survey. We'll be running it maybe towards the end of this year, beginning of next, so that we're ready to kind of report more on that. And and I think we'll be drilling down into getting around with MS. Mobility problems, transport problems, walking difficulties. It comes out, it tops, you know, it absolutely tops the list of things that people are struggling with. And I think it's because there's so many reasons why MS can impact your walking ability. It could be balance, it could be ataxia, it could be spasticity or stiff muscles, it could be pain. I mean, it's really tricky, isn't it? Or fatigue, you know, if you just can't physically get yourself out of the sofa because it just feels like huge amounts of effort.
But also with both mobility problems and fatigue, you get that whole planning when you're going to go out as well. And seeing on the news, you know, we're talking about shutting down ticket offices as well, because obviously that's going to impact. How am I going to get onto the train? How am I going to get my ticket? How am I going to get through the barriers if nobody's there? There's so much things that able-bodied people just don't think about when it comes to this. So I think one thing that really stayed with me when we did the podcast with Hayley was that she was saying, if we're not seen, we're not heard. And we really feel like, you know, the more we're doing about mobility issues and people getting out and about is so important, because
absolutely,
if we want to help people's mental health, they need to be able to get
right
out.
Now, the more bus drivers that say, I had to help somebody on with a wheelchair, or I had to help somebody on with a walking frame. The more buses will be improved to be accessible. The more trains. The more people use the services that are out there, the better they'll become for us. So it does feel like a tricky moment though at the moment, doesn't it, with the rail network? We're hearing an awful lot in the news about people really struggling to get access to a toilet on board train, to even board the train with, you know, step-free access or a ramp. I mean, it's so difficult.
I feel we've had a few people send in stories about like getting out and about and planning their days and things like that. And we really appreciate people doing that, because I feel like seeing how other people cope with things will help people to make their own plans and things. So, you know, keep those stories coming, please.
Do I see Philippa's got a comment there? Be great if so Philippa says it would be great if nurses or neuros would check in on mental health. Hope this has improved soon. Absolutely. Like your arse, if it's a routine part, and so it's accepted that your mental health could be affected, then maybe people would feel more confident in speaking up.
Definitely.
But as I said, I think there's a bit of reticence about asking if they know that there's nothing much they can do. But I think just knowing, just a friendly conversation that this is real and this is
And I feel like, you know, I've certainly met a lot of MS nurses myself over the years, and some have asked, some have not. It would be really interesting to know, if you're in the chat, just to say, has your MS nurse ever asked you about your mental health without you having to bring up the issue?
So Hilary also says, I don't speak about mental health with my neuro nurse because they don't ask MRIs and they're about meds. It's all very clinical stuff. I think possibly where appointment time is quite limited, and they're focused on diagnostics, they're focused on monitoring any treatments, And it is, you're right, it's quite transactional, isn't it? You know, let's do the test, here's the result, this is what we're going to do. The whole person around it is not always fully addressed, I think.
I find for myself that there's quite a bit of a difference from when you have your sort of yearly appointment, then you get asked all these things. I find like I have to actually approach the MS nurse and ask them about any other extras sort of things if I'm struggling with something via email. And generally my nurse is quite good at responding. And we know that it's a struggle in the NHS at the moment. But I feel like if you feel like mental health is an issue or any of these symptoms, do get in touch with your nurse and do ask them. But can we also say, obviously we're here to answer questions and things as well. So what's the best way to get in touch with us, Claire?
So if you have a particular question about MS as it relates to you, then I would say our inquiry service, and that's ask@mstrust.org.uk. And the dedicated professional team are very, very very approachable and friendly, and we can absolutely talk you through stuff and give you evidence-based information to help you move forward with your life. If you've got a comment or a suggestion for new content, new things that you think we should be talking about or writing about in our books on our website, then do write to me at resources@mstrust.org.uk. And I guess anything in particular about the podcast, more generally, that would come to you and Nick at the comms team, comms at mstrust.org.uk.
Yeah.
Obviously, our phone numbers are all over the website as well. I horrified to say I can't rattle it off the top of my head.
We'll read it off in the end. But I think also, if you want to, you can always send us messages on our social media channels as well. We are on Facebook, Twitter, X, Instagram, TikTok, and
Threads.
And Threads now. So you can always send us a message on there as well. If you're on our Facebook group, join that. You can ask questions on there. You can ask them anonymously on there.
Yes, anonymous. A lot of people are starting to use the anonymous function on the Facebook group more often. I think that's lovely because it means that you can get an answer from other people who are going through things like you. And obviously, everyone's different. They won't be in exactly the same place and will have different opinions. But I think getting that sense that you're not alone is really valuable. Yeah. Obviously, mental health. There are specific mental health services and charities as well. Yeah. There's a link on the website, and we'll share it. Put together a really handy list of all the other support charities that are out there. Yeah. Depending on what you're facing. Yeah. It's tough, and I think the MS and the mental health service response can be quite fragmented, but I think a little bit of persistence if you can. You do deserve help. You do deserve support for this. So don't brush it off.
Now, I'm just checking the time. Do we have time for some questions?
Absolutely.
If there are any questions?
Yeah, any questions. Very happy to take questions.
As you can see, Nick is scribbling on a piece of paper here. But I want to say thank you to everyone who's commented so far. It's always interesting doing these live because you never know who's going to be watching.
Anthony's reported there that MS mental health was brought up.
Oh, brilliant!
At a mental health workshop, which completely changed his perspective on life. So that's really positive.
That's really good,
and it shows the impact when you do get the right support.
Yeah.
Adrian says that his MS nurse is rarely present and isn't proactive regarding mental health, which is a real shame. But he's paid to see a neurologist privately who made him aware of a neuropsychotherapist. Well, that's amazing.
Yeah.
But as he says, first he'd heard of that in 15 years.
Yeah.
So I think, if you don't know the landscape that's out there, I mean, I feel sometimes that you have to have a specialist.
Yeah.
To help you find out what's out there in your area. It's so.
Oh yeah, no, it's such a tricky field to navigate, isn't it? It's not straightforward, and we all know that sometimes different services don't really talk to each other.
It was really nice to see that. I think Anthony, he just thought up, who has become a lead mental health first aider himself at work.
That's brilliant.
So I think somebody who really appreciates the impact of mental health, has got so much to offer to a wider organisation to help learn about that.
Yeah, I always find that so encouraging when we do have people that have gone through something and actually want to share their story. It really helps.
Yeah. Hello, chronically Clementine. Nice to see you again. Mental health was brought up for them at an in-person visit after admitting services and support had been poor, and they and other patients had fallen through the cracks. So that's interesting that services are starting to realise that. That's great.
Yeah.
And Louise also reports that she hasn't been asked about her mental health. Lots of other things, but not that. I mean, there's a limited amount of time in an appointment, but if this is a thing that matters, don't let it get. What is it? The nurses call it? There's the doorknob question. You've had the appointment, and you get up and you say goodbye, and you're still holding the door. And oh, just one more thing.
Yes.
And the nurses and the doctors know that the thing that you're asking as you walk out, that just one more thing. That's actually the thing that's bothering you most.
Yeah.
It's so get that thing out first. Get it out there.
Have we got any good tips on how to prepare for talking to your nurse? Because I feel like for myself, I like to write down questions, because I'm like that when I sit down and then they ask something completely different, and you start talking about that, and you kind of forget the questions that you actually had.
I think having some notes to remind you what you want to cover. If you're comfortable having another person in there with you and you've got somebody, then that's totally fine to take in, I call them an auxiliary memory person, to help with that. If you can email them in advance, if you've got that kind of relationship or service, and say, look, I'm coming in to see you tomorrow or next week, here are the things I want to cover, so it's on their list as well. I think those sort of things can really help.
Have we got any sort of, if you are a partner of someone with MS, you might be struggling with mental health as well, because people are always welcome to contact us, obviously, even if they don't have MS themselves.
The inquiry service and the helpline, those are not just for people with MS, they're for anyone affected by MS. And we absolutely recognise that partners, family, friends will have questions. We get people who say, oh, I've just employed a person who's disclosed MS. How do I support them? What can I do? Which is lovely when we get that actually. So it can really be helpful.
Wow, that's really good. Is there any more questions?
So Alison says, both has got, this is the other thing, comorbidity. I guess Alison reports that she's had her MS diagnosis. She's had her MS symptoms for a long time before her diagnosis, but also bipolar syndrome for a long time before diagnosis. And I think untangling these things, just because you have MS does not mean you can't get anything else.
That's very, very true.
There's a lot of most people with MS, I think, live with another condition. And that might be a mental health condition. It might be unrelated to MS. It might be exacerbated by MS. It might be entirely different and special. We're all special snowflakes, aren't we, Helena?
Definitely. I think when we did one of these last one that we did, which was specifically about mental health, Roshan said, it's not just about how MS can affect your mental health, but like how mental health can affect MS as well.
Well, that's something we haven't really covered, isn't it? We haven't really talked about that. I mean, we said, if you can get a bit of a better handle on your symptoms and feel that they're confident, that they're well managed, then that can have a knock-on effect on your mental health in a positive way. But I think things like fatigue and pain and our perception of them can really change when we're low. If we're feeling emotionally down, then everything else can feel quite overwhelming. So maybe we cope better with things when we are not under mental pressure. So it's a very complicated thing to unpick, and it's going to be very individual too.
And it's not to try and think of treating things in isolation, is it? It's kind of we need to look at all of it.
Absolutely.
Right. I think maybe that's all we have time for today.
Oh, it's been lovely to chat. You and I can always chat for hours.
We can talk for ages, yes. But I'm looking forward to hearing about the report when it comes out next time.
It's very important to me that we thank the people that have contributed to that report and given us, have responded to the survey and given us that data. It's really important to me that you hear about the report and you, So don't worry, we'll be back again next year with the mobility and transport report.
And once the report is sent out, then we hope that we get even more responses than we got.
Can we see? Can we beat 2,068 responses? So watch this space, look out for the survey, and please share it with anybody you think has got something to say.
I think that's it. So finally, if we didn't get around to answering any questions, feel free to contact the MS Trust Inquiry Service, which Claire's already mentioned. They're available Monday to Friday, except UK bank holidays from 9 a.m. to 5 p.m. And outside of these hours, you can leave us a message and we will get back to you as soon as possible. So the phone number is 0800 032 3839, or you can email ask@mstrust.org.uk. So thank you so much, Claire, for chatting to me today. And thanks to everybody who tuned in, everybody in the chat, and everybody who's been listening, and everybody who is listening to this as a recorded podcast. We will put this out as a podcast a little bit later on in the month. You can find our podcast, Multiple Sclerosis, Breaking It Down, in most places where you would normally find a podcast. So Apple, Spotify, Google, and Amazon. And of course, if you do prefer a video, we're on YouTube too, so you can look at the slides and everything that we were talking about. But we have linked to them in the comments as well. And please let us know what you think about the podcast, and we would love a review, a review. So I think this is the end. So I would just want to say thank you and goodbye, and see you for the next one.
Bye.
Bye.